Dr. Drew, will you also speak a bit about how marijuana alters human cells and DNA? Many smokers feel it is harmless. What do you say to those who claim pot cures cancer? Does it cure cancer? Well, those are two different issues. Let's start with does the pot cure cancer?
Well, okay. When people talk about cancer cures, I first, scientific literacy is really at an all-time low in this country, I'm sorry to say, and particularly biological literacy. Cancer is hundreds of different illnesses. It's like saying it cures disease, because cancer is not one monolithic illness. It's hundreds of different. Prostate cancer is one illness. Lung cancer is another illness. Leukemia, lymphomas, other illnesses. And so to say, and each of them have completely different biologies. They share the basic phenomenon that there's a genetic error that sends the growth of a particular cell line out of control. But the manifestations of that particular cell line being out of control is vastly different than another. Or even within a tumor, the different cells that are out of control can have different needs for different kinds of treatment. So the idea of there being a cure for cancer is anathema. It's bizarre. So I'm sorry, pot, I wish it could cure. I wish. It'd be great if we just smoke a little pot to get over it. I'd be high right now. I'd be like Charlotte Green, who you interviewed a few minutes ago, smoking up right here on this show. But it's not like that. It's just not like that.
Well, it's not like that, but again, one of the aspects of being a doctor in the news is the issue of medical marijuana comes up all the time. And to Rick's earlier element to the question, he wants to know, you do have a stance on this.
No, I really don't. Well,
you have a,
no, I don't. People think I do.
On the medicalization of it. That's the thing. You said there's no such good, I know you've said there's no such thing as a good drug or a bad drug. Yes,
I do say. So let me get into that with you. I had Charla on my program on HLN last night, who you just saw smoking pot on the air, which I thought was very fun. And we had a nice conversation about this because I don't believe there's such thing as a good drug or a bad drug. I've been treating drug addicts for 20 plus years, and the idea that there's that alcohol is a good drug or nicotine is a good drug and therefore legal, and OxyContin is a good drug under certain circumstances, or cannabis is a bad drug, or heroin's a bad drug. No, none of these things are good or bad. Our laws are bizarre as they pertain to substances. They're just bizarre. And then our moralizing based on the laws is even more bizarre. These are chemicals that have good and bad properties. And in certain circumstances, they're very good. If you have pancreatic cancer, OxyContin, very good. If you have a fine dinner and you're not an alcoholic, alcohol, very good. But if you're an alcoholic, alcohol, bad. If you're an opiate addict, OxyContin, bad. So it depends on the context of these things. And our laws are just very bizarre. I agree with people that have problems with the inconsistencies in the laws. But I don't feel like I'm in a position to comment on the laws. I don't make laws. I'm not a legislator.
You're just trying to make people
doctor.
Healthy.
People think I'm like the bummer guy that wants to say drugs are all bad. I've never said that. I've said if you have trouble you can't stop and you want help stopping, I can help.
And you said
there are lots of drugs that do
these
that.
Things. I mean, these are.
I prescribe pot. I had a heroin addicted, cannabis addicted, dying of cancer and vascular disease woman who was staying off heroin with pot and was going to die within 6 months who wanted cannabis.
And you gave morphine.
If she wanted morphine, I would have given her that. Why would I hold these things? You're talking about human suffering, and doctors can help with human sufferings, and they need a range of medication to be able to do that.
Taking the element of illness out of it.
And by the way, you're talking about the medicalization. What I don't like about the medicalization is that people that distribute the pot often practice bad medicine. That's what I don't like.
I'm from Los Angeles.
You've seen those dispensaries. You don't have to go in the dispensary. You can walk slowly by and grab your prescription. All my drug addicts have. Every drug addict I've treated in the last 5 years or so has a marijuana prescription. That's bad medicine.
Well, here's the thing.
That's practicing bad medicine.
When you say the word addict, a big phrase that freaks people out is whether or not marijuana is addictive.
It's not addictive for everybody, just the way alcohol is not addictive for everybody. But for some people it is, and it's really hard for them to stop. And when they can't stop, that's when I help them. And I've helped 1,000 marijuana addicts in my career, maybe 800 or something like that.
Why do people get so upset when you say that marijuana could be addictive?
I don't know. I have no problem with legalization. I have no problem with them using. I have no problem with anything. I have a problem with people that can't stop and would like to stop. I can help them. Is the implication that I'm lying or that these people could have stopped if they want to? I mean, how bizarre.
Maybe the implication that you are literally a buzzkill.
Well, I'm not. But I am not a buzzkill. That's the whole point. They should enjoy. I have no position on that. And the point is about the laws is I believe the people should make the laws. And if they want a certain law, they should have it. And then I, as a physician, will help deal with whatever the consequences are. I was up in Colorado last week, and there have been consequences. I mean, there have been some real medical consequences from the law change up there. And as a result, everyone's kind of reconsidering that law, and that's freaking out the the pro-legalizing people. And I understand that, I get that, but let's not pretend these aren't these consequences, because they have happened. And there've also been some benefits too. I mean, listen, they're saving money on the jails and things. That's a good thing.